In today's morning rounds, a new virus that has killed 9 people and infected hundreds more in China has now spread to the U.S. A man in his 30s from Washington state is the first person in America to be diagnosed with coronavirus, it's called. The man returned to the Seattle area last week from a trip to Wuhan. That's a city in central China where the outbreak began. Right now, that patient is in isolation in a hospital north of Seattle.
Our number one priority is to complete the identification of all the patient's contacts, reach out to the contacts, and monitor their health. We also want to make
enhanced screening is already in place at 3 U.S. airports, with 2 more being added this week. Our Dr. Tara Narula is here at the table with more on this story. You hear about it, you see the mask, it's very disturbing. How worried should we be?
Yeah, I mean,
what is it exactly?
So this is a form of coronavirus. We've known about coronaviruses before. This is a new strain. This is a virus that's found worldwide. It causes typically a mild or moderate respiratory illness, but it can be more severe. We saw that with SARS and MERS, which are also forms of coronavirus. So certainly the CDC is recommending that we be cautious about this, that we be proactive, because it is a new strain. It is contagious. So interestingly, they think it does circulate in animals, and occasionally can make the jump from animals to humans, which is what they think happened in this case, because the initial cases were surrounding an area, a market, a seafood animal market in the Wuhan area. And so they think that it started in animals, was transmitted to humans, and now they're saying that, in fact, it is spread between human to humans.
And there's no vaccine right now, so how are people being treated?
There's no vaccine. The NIH is doing research to develop a vaccine, but that's a ways away. And so it's really supportive care at this point, which means, fluids, rest, pain medications, medicines to lower fever, temperature.
How are health officials tracking the spread of this virus? How are they looking for people who may be infected?
Well, certainly with this case, they've sent, a team to Washington, and they're doing a trace back where they're looking at everyone that this gentleman may have come in contact with back in China, on the plane, in the United States, and they have activated kind of their emergency operations. They're also in communication with the WHO, which is convening a meeting today to decide whether they're going to declare this a worldwide public health emergency.
We see these pictures of people wearing the kind of the masks out in public. Do those do anything to prevent infection?
Well, certainly we think that this is spread by droplets, so, airborne precautions like wearing a mask can help. Also, if you touch a surface, kind of like the flu, it can be spread that way. So hand washing, disinfection.
What are the symptoms, Tara?
So it can be anything from fever to cough, respiratory difficulties, shortness of breath, muscle aches. It can progress to pneumonia. And, there have been some deaths, although the deaths that have occurred have been in those who are older than 60 and also seem to have underlying medical conditions. So I think the big message here is not to panic. The CDC is saying that at this point, the risk to the general public is low.
So if you haven't been to China or haven't been in contact with somebody who's been to China, do you have reason to be concerned?
I think the CDC is saying, again, the risk is low. So they said for anyone kind of sitting around their dinner table, this is not something that you have to be worried about. But certainly because it is a new strain and people don't have immunity to it and strains can mutate and change, they are worried. And that's why they're saying we need to be prepared and proactive and take kind of a widespread public health approach, which is what they're doing. And they've seen this before. They've done this before in SARS and MERS. So.
All right. Dr. Tara Narula, thanks.